Welcome to today's Medicare 360 show, where we simplify Medicare so you can make confident decisions for yourself and your family. I'm your host, Jennifer Alfonso Lee, and today's episode is one of the most important conversations we have because it's happening right now to thousands of seniors. And it usually starts like this: I didn't change my plan, so why is everything different? Why is my doctor no longer in network? Or even, why did my prescription suddenly cost me more? So here's the truth. Most people don't realize your Medicare plan can change even if you don't. So today we are going to break down why plans change every year, why doctors and medical groups leave networks, why medications get more expensive, what letters actually matter, and what you should be doing right now to protect yourself. Because ignoring these changes can cost you in money, access, and stress. So, why Medicare plans change every year? So, let's start with the foundations. Every Medicare plan is approved and regulated by the Center of Medicare and Medicaid Services, also known as CMS. Plans are renewed annually, but they are not permanent. So this means each year, insurance companies can adjust premiums, copays, provider networks, drug formularies, and extra benefits. So why? Because healthcare costs does change. The doctor's contracts change, the drug prices change, hospital systems renegotiate. Sorry, I have a little bit of a cold. And so, and also, what the government gives Medicare also changes every single year as well. So that's another big thing. So even if you stay in the same plan, the plan itself may not be the same. So that's the thing, right? That's why your agent will call you every single year to just update you on the changes if there isn't any. Many stable companies will not really make a lot of changes unless they got a cut from Medicare. And then also, if their star ratings have gone down, that means they also get less money from Medicare. So there's just so many factors that come to a play in your healthcare, just not your doctors and the level quality of hospitals and your doctors and your specialists, but also the financial portion, right? Like the insurance portion, the coverage portion. And unfortunately, that does have to do with money, right? Money that these insurance companies receive from the government, and that could change and fluctuate yearly based on what the government decides to provide, and also what the insurance company's star ratings are. So the star ratings are, if they'd have pretty good star ratings, they will get more money. So things like that to look out for when you are looking at a plan. I do have clients that just change from plan to plan every single year, and that's fine. But of course, most want stability in their plan and want to stay in their plan for a very long time. Oh gosh, sorry. I'm just getting from sickness from the whole weekend. Okay, so let's talk about the letters you are receiving and also maybe ignoring. Let's talk about the mail, the millions of mail that you receive, stacks and stacks. So most seniors receive stacks of Medicare related mail, and understandably, it could feel very overwhelming. I mean, I go to my parents' house and they travel and pick up their mail, and it's just tons. It's too much unless you're a reader and you like to open mail up. a lot of people just throw things away, right? And which, yes, most of it is going to be trash, but there may be some important documentation too. So be mindful of that. One of the most important documents you will receive is the annual notice of change. It's called ANOC. And this is not marketing, right? This is what your plan is telling you is the changes for next year, right? So what's changing next year, what's staying the same, what you'll pay, what networks are shifting. So if you really do want to understand your plan for the following year, please read it because often if there's some drastic changes to your plan and you don't read your mail, then you know maybe 3 months out of the year come by and you're like, oh my gosh, I don't have these benefits. It's because maybe you didn't read your mail or your agent did call you and you just never picked up or you just said whatever, I don't care, or like I'm good with my plan, right? But we are to educate you here to make sure that you understand the plan changes. So the problem is most people don't open their mail, don't understand it, or assume nothing has changed. And really, some of this mail is not very easy to read and simplify. So that is what we're here for to help you simplify it as well. So the reality is, inside that document could be a doctor leaving your network, a hospital no longer covered, a medication moving to a higher tier, and a copay increase. Okay, and unfortunately, really, the medication, it's not going to list all your medication. So that's why you do get a hired expert, an agent like me, to help make sure that all your drugs are covered. And even if they're covered, did they raise in price, right? Because some carriers actually increased their deductible. They may have not had a deductible the following years, and now the carrier is just like, we need to put a deductible because you were losing money or whatever it may be, and you'll be shocked to get a deductible in the first of the year when you pick up your medication. So, understanding it, learning it, and the knowledge of at least being expected or making a change before it's too late is vitally really important. So once again, the reality is that it could be a doctor leaving your network, a hospital no longer covered, a medication moving to a higher tier, or a copay increase. So this simple teaching line would be the most expensive mistake in Medicare is ignoring the letter that told you everything, right? And sometimes these letters don't tell you everything. So please reach out to us and we will help you tell you everything that you need to know about these plans. Okay, let's talk about the doctor and medical group changes. That is a big issue. This is especially important in Southern California. Many Medicare Advantage plans operate through medical groups or IPAs, which are called Independent Practice Associations. And these group contract with insurance plans, and those contracts could change. Sorry for the raspy voice today. So, why do doctors leave networks? Um, Reimbursement disputes, contract negotiations, administrative burden, strategic changes. And really, another one is what if that medical group doesn't want that doctor anymore, right? Based on some scores and ratios that they also do. So, like real life scenarios that have been happening. Client tells me I had a doctor for 15 years. Suddenly they're not in the plan. What happened? Not the insurance, the medical group contract changed, right? So, like, I did have one just last week, and where a client had a doctor and specialist, and unfortunately, that doctor wasn't in that medical group anymore. So a couple of things a client could have done is just change out his doctor from the insurance company to change the medical group possibility, or just change their plan altogether. So by looking at his doctors and his specialists with that insurance company, they weren't going to align. They weren't in the same medical group. So that may have not been an option. Looking at other insurance companies, more of their doctors were able to align, right? So that might have been a better option. And also, their benefits actually were going to be higher if they switched over to a different plan. And yes, we are not in the open enrollment phase, but I mean, there are special enrollment periods, FEMA, that are used because if you didn't make a change, because we had like a flood, fire, earthquake, things like that, you were able to make a change. So that's like a classic example of, hey, you know what? I know sometimes change isn't good. People do not like change, but this client is actually going to keep all his doctors and get better benefits on his plan by making this change. Like, I mean, he was going to save a lot of money, and he was very loyal to this insurance company, been with them for a long time. Hey, but things change. Primarily, patients do like to keep their doctors if they're very happy with their doctors. So that's the biggest thing. So in Southern California, the reality is here your experience is often driven by the medical group and not just the insurance carrier. Most people could have the same plan, but very different experiences based on their assigned group. And so that's the thing, right? You can't really compare yourself to your neighbor, your friend, your family member, just because your specific situation, your doctor, medical group may be different than theirs, right? So keep that in mind when you're chatting with people in regards to like what are the best plans. And also, um, what was I going to say? Yeah, mainly most people, blame the insurance company for things, and it might not be the insurance company. It might be the medical group that's the one steering your healthcare and, where labs you're going to, what specialists you're seeing, what they will approve and deny, right? So the teaching moment here is you're just not choosing a plan. You're choosing a healthcare system as well, right? And while most say like, oh, I'm very healthy, I don't care, don't see the doctor. But hey, when the time comes, you do have to see a doctor, you have an emergency, you have to go to a hospital. I personally would want the best care for myself, right? Versus just a mediocre doctor, specialist, hospital to go to. And you could start, listening or hearing around on what medical groups and hospitals are really good for care, and you probably may have experienced this or know someone that has as well. So, the teaching moment here is you're just not choosing a plan. Like I mentioned, you're choosing a healthcare system. So, I do want to jump over to prescription drug changes. Let's talk about medications, another major frustration point. So every year, plans update their drug formulary, which is their list of covered medication. What can change? Drug tier cost, right? So there are tier ones, twos, threes, fours, fives, right? So depending on where your drug falls, could depend on the cost increases or decreases. Okay, prior authorization requirements. Maybe the year before you didn't have to get prior authorizations, but now some of your medication is required. So prior authorization is your doctor does have to do a write-up to approve that you have to take that specific medication. And then quantity limits. So, I mean, as things are tightening up and you are seeing this, right, with inflation and just everything going up, um, your insurance plan could actually change the quantity that's limited to. There are exceptions, and that's what we could help you with that as well. And then removal from formulary. So it could happen that your prescription drug that you were taking last year wasn't approved this year. So either it's going to be denied and you have to pay cash for it, or you could go through the necessary procedures like filing an appeal to get that approved, which usually then your doctor has to write a note that basically says that they want to approve that for you because you really do need to take it. So, um, like a scenario would be a client pays $10 last year or even zero, and now it's going to be $42. Same medication. Why? Because it moved tiers, right? Let's just say it moved from tier one, which was zero cost, and then it moved to tier three, which is like $42. So something like that. So another scenario would be your drug is a tier three drug, used to pay $42. And then this year, now there's a deductible for the tier three drug. And so before you pay the $42, you have to hit the deductible. And let's just say the deductible is $255. So if the drug costs $100, you'd have to pay the $100 first, and then another $100, and then half of 55, which would add to I'm not half, the 55 for half of the drug, which should be 255 until the $42 hit, right? And like times are tough, so I mean that big $100 versus paying the 42 could mean the difference. So things like that we definitely look at and make sure that you are on the right plan for that. So, the important reminder is even if your plan name stays the same, your drug may not, right? So, just be leery and careful about that. So the teaching line is never assume your prescriptions will cost the same next year. Okay, let's talk about the benefit changes, the good and the bad. Let's talk about the extras, right? Plans compete by offering you givebacks, which are we'll give you money back on your Social Security if you get this plan for us. Flex cards, right? Like everyone's using it for like the grocery cards, the utility cards. People love that. Dental, vision, over the counter benefits. But the reality is these benefits could change, right? They could actually increase and you get more, or they could actually decrease your benefits or actually eliminate it altogether. So what we see are lower givebacks. And if you are on a lower giveback plan, there's some carriers that really want your business, so they're offering higher givebacks, right? And most people don't look at that because they're fine with their plan, their Social Security's increasing, so they're not seeing the big change of the give back being lower. The changed flex card category. So the biggest thing that's come out is that many people were on plans that had these flex cards were like these Visa or MasterCard debit cards where you could just use at the grocery utility. But now like Medicare is being more strict on like these cards are only meant for chronic condition patients. So you need to provide proof if you have a chronic condition. So many of these times this person may not have it, and this insurance company was lax before in regards to like just giving it to everyone. So that's not good. Dental, reduced dental maximums. So that also has definitely changed. Fortunately, I've seen it go decrease versus increase your dental benefits, but there are dental plans that are still embedded that are still good. So that's something we definitely could talk about to make sure you are on the right plan. Over the counter adjustments, basically like you may have less over the counter as well on that. So the mistake is choosing a plan based only on extras, right? You live by the sword, you die by the sword. You get the plan with the most benefits, which is awesome. And then the year after, all those benefits go down the drain just because maybe they were giving out too much. So sometimes the stability of the plan is very, very important. So the teaching line on this is extras are bonuses, not the foundation of your healthcare. I would say your healthcare should be the level of care you receive, the quality of care you receive from your doctor, your specialist, your medical group, and the hospitals that you go to. Okay, so the biggest mistake seniors make, let's summarize the biggest mistakes. I didn't change anything, so I'm fine. Plans change automatically, so remember that. Ignoring important letters, especially the ANOC, right? That shows you what are the changes, but please keep in mind it doesn't show you like your drug changes on exact drugs. So that's why you contact us. Not checking doctors annually. This is a big thing. Your doctors may not accept that plan anymore, that medical group. So keep that in mind. Not reviewing prescriptions. Big one too, right? The cost shift, the tier levels, the deductibles, all that comes into play. Then choosing based on TV ads, not personalized to your situation. So this is a big one. You just call up and then you sign up for a plan because you think that everything they offered you on that ad you're going to have, but that's not necessarily true. You may have requirements for that, like Medi-Cal, Medicaid, like chronic conditions. So please contact us for that as well. So, what should you do right now? Here's what I recommend. Step one, review your plan annually, even if you like it, right? Talk to your broker, just say, make sure everything's like in the up and up, so you're not surprised, right, when the following year comes to play. And answer your broker's calls because sometimes I have a very important issue to talk to you about and you do not answer your phone, so I cannot help, right? Um, Step two, confirm your doctor's primary and specialist. Step three is review your medications, check your coverage and costs. Step four, understand your medical group, especially in Southern California. We're very big on this. Step five, ask questions, don't assume. And then, if you remember one thing from today's show, let it be this: your Medicare plan does not stay the same, even if you do. And the difference between prepared and being surprised often comes down to one thing: understanding the changes before you need care. So at Medicare 360, our mission is education first, helping you understand how Medicare works in real life. If you received letters, notice changes, or just want clarity, it's definitely worth reviewing your situation. So thank you for spending this time with me. I'm Jennifer Alfonso Lee, and this is Medicare 360, where clarity always becomes, oh gosh, where clarity always comes before coverage. You have a wonderful day.